so it is 6:52, June 17th, and this is my blank paper I'm going to use to document. Okay, so knock, knock, knock. My name is Holly. I'm your student nurse. I'm going to give you some privacy, so I'm going to close the curtains. I'm going to wash my hands. So can you tell me your name and date of birth?
Robert DeCenso, December 4th, 1990.
Okay, so I'm going to ask you a few questions. So do you know where you're at right
I am at the hospital.
now? Okay, and then do you know the date and time?
June 17th, maybe about 6:50.
Yeah, pretty close. Do you know why you're here?
I'm here for a physical.
Okay, that is correct. So one last question for mobility. Are you able to stand up and walk by yourself, or do you use a cane or a wheelchair?
I can do it by myself. I don't need assistance.
Okay, good. So I'm going to step to the side and do my general survey, which is the PAMS BM. So for the P, which is going to be physical appearance, gender, male, Caucasian, and 29 years old. And for the A, it's going to be affect, which is going to be the mood, behavior. So he's happy, smiling, cooperative. And then for the M, which is mental status, he's ANO times 4. And for the speech, for the S, speech is clear, not slurred. And for the B, body structure, tall, lean, proportional. And for the M, mobility, as mentioned earlier, doesn't need help with walking, no assistive devices. So I'm going to come back. So I'm going to be doing your physical today. So are you having any pains that I need to know about?
No.
Okay. And is it okay if I touch you today?
That's fine.
Okay, so I'm going to make sure my hands are warm, and I'm going to start with the head. So I'm going to inspect and see that it's symmetrical, shape is round, facial features are proportional, and I'm going to kind of, back of my hand feel the skin. So skin is warm, no excess moisture or dryness. Skin color is normal for ethnicity. And then what I'm going to have you do, I'm actually going to have you sit up on the bed for me. So if you turn around, kind of sit down here, so everyone can see you. Okay, so I'm going to inspect your eyes. So I'm going to shining a light in. So I'm going to look at the sclera. Sclera is white and smooth, and the conjunctiva is pink and moist and intact. And then I'm going to have you follow this light for me. Okay, follow your eyes. Okay, so I'm going to check the pupils. This side, that side. Okay, so pupils have perla, which is pupils equal, round, react to the light, and accommodation. Eyes are consensual. And are you having any vision changes?
No.
Okay, and do you wear glasses or contacts?
I don't.
Okay, so we are going to now look at your ears, inspect them. So I'm going to inspect the back of the ears. I'll just do both. Okay, so no redness, pinna is intact. No lesions, and then I'm going to look into the ear canal. Okay, so no excess wax, no drainage. Let's look on this side. Around. Yep, so same thing, no excess wax or drainage. And are you having any hearing changes at all?
No.
Okay, and you wear a hearing aid in either ear?
I do not.
Okay, so let's look at your nose. So I'm going to have you kind of look up towards the ceiling, just going to look in there. So the mucosa is pink and moist, nose is intact, and are you having any discharge or congestion or anything?
No.
No, okay. And any changes in smell?
No.
Okay, let's look at your mouth. So do you wear any dentures?
No.
Okay, so I'll have you open up. So oral mucosa is pink and moist, intact. Tongue is pink and moist, no dry appearance. Dentation is good. And do you have you had any changes in taste or appetite?
Nope.
Okay. So now that we're done with your mouth, we're gonna move on to your neck and throat. So I'm gonna kind of touch, your neck. And temperature is warm, no excess moisture or dryness. Skin color is normal, no lesions. And have you been having any pain at all in your neck?
No.
Okay, so let's check the turgor. So this is going to be on the clavicle. I'm just going to do a pinch. Okay, so there's no tenting. And now I'm going to help you with your range of motions if that's okay.
Mm-hmm.
So I'm going to have you tilt your chin down to your chest. Go slow and then go back. Then I'll have you turn to the left and turn to the right. Then we're going to bring head to shoulder to the left side, head to shoulder to the right. Okay, so range of motion is normal. And then now we're going to move down to the chest. So is it okay if I move your shirt up and down for this part?
That's fine.
Okay, so I'm going to kind of pull it down. So I'm going to feel the skin so it's warm, no excess moisture or dryness, no lesions or marks. And then we're going to inspect the chest. So this chest is symmetrical. The AP ratio is 1:2. Coastal angle is less than 90 degrees and body is proportional. So now that we've inspected the chest, we are going to check respiration. So you're going to be breathing in and out through your mouth. So just kind of do one in and out. Okay, so I'm probably going to have you lie down to check respirations, and then we'll sit up again. Okay, so I'm just going to have you kind of lightly put your hands over your chest, and then for 30 seconds, just breathe like normal. Okay. Okay. So respiration rate was 20. Okay. Now that we're done checking the respiration rate, I'm actually going to have you sit back up for me so I can check your lung sounds. Okay, so we're going to do 4 pairs on the interior of the chest, 5 pairs on the posterior of the chest. Okay, and then for each one, I'm going to have you breathe in and out. So we're going to start in the third of the clavicle on the right side. So I'm going to start here and have you breathe in and out. Okay, let's go to the left, breathe in and out. We'll go down to intercostals, have you breathe in and out. Go over to the right, breathe in and out. Okay, go down 2 more intercostals, breathe in and out. In and out. Go down 2, breathe in, out, breathe in, breathe out. Okay, now we're going to go to the back and do the 5 pairs. Okay, so I'm going to start up here, have you breathe in and out. Over, breathe in and out. Breathe in, out, in, out, in, out, in, out, in, out, in, out. Last one, in, out, and one more on the right. In, out. Okay. So I have you keep sitting up so I can check your heart. So for the lung sounds, the rhythm was regular, depth was regular, no use of accessory muscles, and unlabored breathing for the effort. And for the heart sounds, we're going to do ape demand. So put this back on. So we're going to start the second intercostal on the right side. This is going to be the A, which is the atrial valve. Okay, you can just breathe like normal. Okay, then we're going to jump over to the other side and listen to the pulmonic valve. Okay, and then both of the ones I just said are going to have the S2 being the loudest. I'm going to jump down an intercostal. This is going to be the Erb's point. So S1 is going to be equal to S2. Jump down one more intercostal. So this is going to be the tricuspid valve. So this is going to be S1 is going to be loudest. Jump down to the 5th intercostal, and this is going to be the mitral valve, and this is going to be S2 loudest, and this is where the PMI is, point of maximal impulse, and this is where we're going to check the apical pulse. Okay, so I'm going to do this for 30 seconds. So you just got to breathe like normal. Okay. So, apical pulse was 80, so I'm going to document that. Okay, so now that we're done with the heart sounds, we're going to, well, also to mention for the heart sounds, S1 and S2 were heard, no extra sound, rhythm was regular. So we're going to check your abdomen, so I'm going to have you lay all the way down on the bed. Okay, so I'm going to have you lift your shirt up for me if that's okay. Mm-hmm. Okay, so we're going to inspect the abdomen. It's flat, it's proportional, symmetrical, and I'm going to feel the back of my hand, the skin. So skin's warm, no excess moisture or dryness. Color's normal for ethnicity, no lesions or marks or anything. And are you having any pain at all in your abdomen?
No.
Okay, so since there's no pain, we're going to auscultate the bell sounds. So we're going to listen to each quadrant 15 seconds. So I'm going to start in the right lower quadrant and listen for 15 seconds. Okay, and then we're going to go to the right upper quadrant, listen for 15 seconds. Okay, and then we move to the left upper quadrant, listen for 15 seconds. Okay, move down to the left lower quadrant, listen for 15 seconds. Okay, so now that we're done auscultating, so the bell sounds were active, they weren't hypo or hyperactive, they're normal. And now that we're done auscultating, we're going to palpate. So you said there was no pain, so I'm going to go start in the regular right lower quadrant to start with. I'm going to go down 1/2 inch in each quadrant. Okay. Okay, so after palpating, there was no masses or lumps or anything that I noted. So I have you pull your shirt down. Don't need that up anymore. So now that we're done with the abdomen, we'll just talk about bowel movements. So have you been going more than normal, not as frequently, or your bowel movements been normal?
I'd say most likely normal.
Okay.
Mostly normal.
Normal, okay. And then can you describe the bowel movements, like color, consistency, amount?
Normal size, normal amounts. Brown color, maybe soft, pretty soft.
Okay, that sounds normal. So what about urine? Color, clarity, amount?
Typical amounts, pretty clear,
Okay.
maybe light yellow.
Okay, and then also same thing, have you feel like you've been going more often or not enough with urination?
No, I think it's normal now.
Normal? Okay.
Average.
No change?
No change.
Okay, so everything looks good there. So now that we're done with the abdomen, we're going to move to the extremities. So we're going to start with the arms. So we're going to do bilateral inspection. So I'm going to have you kind of pull them out for me. And then we're just going to look at both of them, look for any abnormalities, so no lesions, no marks, temperatures warm, no excess moisture or dryness. And then we're going to inspect the hands. So I'm going to have you grip on for me. Check your grip. Okay, feels like a good grip. We're going to look at the fingernails. So they are round, smooth, pink. And the capillary fill, I'm going to check all of them bilaterally. Okay. Thumbs. Okay, so capillary fill was less than 2 seconds. And then we're going to check the radial pulse. So if you want to kind of just lay them down, flip this one over. We just lay it right there. So I'm going to listen for 30 seconds. was 76 for the radial pulse. Okay, so we are done with the arms. The color also looks good for ethnicity. We're going to move down to the legs. So pull your pant legs up and inspect them. Okay, so overall, legs look symmetric, proportional. Hair distribution looks normal for gender. And then we're also going to look at the toes for the legs. Okay, so toenails, round, pink, smooth. We're going to check the cap refill on each one. Okay, so it's less than 2 seconds on all the cap refills on the toes. And then we're going to check the pulses on the feet. So there's the posterior, dorsal, dorsal pedis on the top one. So I'm going to feel the amplitude for that one. Okay, then we're just going to count for 30 seconds. Okay, so that was 76. I should probably write that down. Alright, so dorsalis pedis was checked, and then we're going to check the vestibular pulse in the back of the heel. 30 seconds. Okay, that was 74. Okay, so now that we've checked both the pulses on the feet, I'm just going to pull these down. Okay, so I don't think there's anything else we need to inspect on you. So are you having any concerns or questions right now?
I do not know.
Okay, so I'm going to make sure you're all the way down in the bed. I'm going to hand you your call light. Here you go. And bed is locked. And then I'm going to wash my hands, grab my sheet. So for my disease, it was hypertension. So 4 questions I would ask the patient if they had hypertension would be if they have high blood pressure medication, if they're adhering to it too, how their diet is, and also I would ask about blood pressure, if they check it at home and how often they're checking it, and then if they have chronic hypertension, so blood pressure would be like 180 over 120, I would ask if they're having any dizziness or headaches. So now I'm going to go to the other room to document, and the time is 7:11. Okay. So for my sheet, just have the respirations and the pulses written down. Nothing on the back. Okay. So the time is 7:13. I'm going to stop the video and open the lockdown browser.